The White House COVID task force is rolling out its plan for COVID vaccine booster shots. They are recommending fully vaccinated people get one 8 months after their second dose of the Pfizer or Moderna shot. WCNC Charlotte's Chloe Leshner is live at Novant Health. Chloe, when can people in our area expect to get that next shot?
Well, Fred, the FDA and CDC still have to give that final approval before local providers could start giving those boosters, but it is looking like it could be the end of September. But then the big question becomes, will it be enough? Half of the state's population still hasn't even gotten the first shot. Summer 2021 looks and feels a lot like the beginning of the year. COVID cases are surging, hospitals are strained, and masks are back on. Vaccines helped many see the light at the end of the tunnel then. And as Delta takes us in the wrong direction, a booster is now likely coming.
The vaccine is starting to wane in its effectiveness against infection. It's still holding up relatively well against severe disease and hospitalization.
Statewide, doctors are seeing that in the very few vaccinated people getting admitted with COVID.
On average, those individuals are 77 years old. They were often vaccinated very early in the pandemic. They typically have a number of other chronic medical problems. So it just speaks to the need for boosters.
The booster would be available to anyone 18 and older 8 months after the second dose of the Pfizer or Moderna vaccine. They're still researching boosters for the Johnson & Johnson shot. Meanwhile, half of the population still won't get the first dose.
We have some individuals in our communities who adamantly don't want a single dose and others who adamantly want the third dose. And that just speaks to kind of the polarization we've seen during the entire pandemic. It's unfortunate, but that's kind of where we are right now.
But the need for another round shouldn't be misconstrued. Doctors say the first 2 shots do provide significant protection.
People are wondering, gosh, if it's waning, should I really even get it? And so, again, just trying to make sure that we're getting the right message out to people that it's super important to get the first 2 vaccines and or the Johnson & Johnson if that's your preference, because there clearly is benefit of the vaccine.
Yesterday, Dr. Mandy Cohen said they are still waiting for some more details on what the exact rollout will look like, but that the state is prepared and ready when it is time for this next round. Meanwhile, though, they really are keeping the focus on getting the unvaccinated vaccinated. So a reminder, there is that $100 incentive, and a lot of doctors' offices do have the vaccine at this point, too. Live at Novant Health, Chloe Leshner, WCNC Charlotte.